Today is June 22nd, and we're continuing the Silver Cross Today video magazine. Today we're showcasing the Information Technology Department, and with me is Teresa Andrea, Administrative Director of IT, and Nathan Collins, who was recently promoted to Security Specialist. Congratulations, Nathan. So Nathan, let's start with you. How long have you been at Silver Cross?
I've been here for 6 years, and thank you for the credit. Congratulations.
You're welcome. You're welcome. It's well deserved, well deserved. And now can you tell us, what does a security specialist do?
So, in a sentence, it's to try and promote the security and safety of information systems here at the hospital and how IT and the hospital at large interacts with patient data.
Okay. So you're the person who makes sure that bad actors don't get into our information systems?
Yeah, I make sure that data classification happens. I make sure that we're not losing or leaking information, as well as we're being very conscientious as we handle patient information.
But you can't do this by yourself. You need everybody's help. This is everybody's job, right?
Yeah, we constantly say, it's everybody's responsibility to try and be safe and secure with patient information.
Yeah, I hope everybody's hearing that. That's really, really important. So, Teresa, how long have you been at Silver Cross?
Well, I've had 2 tours here at Silver.
You're a boomerang.
I'm a boomerang, and so in total about 15 years.
15 years. And right now, what would you say are the top priorities of the IT team?
When I think about the top priorities for IT, the first would be high reliability through stability of systems. Technology is such an integral part of delivering care. We need to provide for a stable environment. The second would be agility to adjust technology. So change can be rapid in healthcare, and we always need to be prepared to make the necessary changes in technology so that we can continue to meet the need. The last, I would say, certainly not least, customer service. We are a serving division, and our customer base is wide, whether it's physicians, registration, nursing, patient accounts. And so there's so many that touch and depend on technology. Customer service always has to be top
And our
of mind.
patients are our customers
Absolutely.
too, so
Absolutely.
they're affected. So you mentioned change and rapid change. So during COVID-19, you had to make many, many rapid changes. Can you give us some examples?
Sure. So Care Connect is one. This we stood that up in 2 weeks. That is
Amazing.
our asynchronous visit telehealth platform, and it also offered free COVID screening to consumers. Another thing, when we had to implement a really strict visitor policy to protect patients and employees, we needed to find a way to keep patients and families connected. So we implemented WebEx on iPads and dispersed through the units. That was really nice because nursing and physicians can keep family and the patient engaged with each other. And it also provided a secure platform to have important and sometimes critical discussions around care.
Sure.
And then just the last thing I would say, just with the multitude of COVID lab orders we had to create or adjustments to documentation to ensure we had appropriate visibility in the chart, and then the multitude of reports to support operations during a pandemic.
Right. So you had to make a certain adjustment to show if a patient had been tested or was positive for COVID right on the end page.
Absolutely.
That was a big deal. Usually that takes a long time.
Yeah, we had to be agile, and we were.
And you were. Thank you. Thank you. Nathan, I worry a lot about cybersecurity. Somebody asks you what keeps you up at night. This one keeps me up at night. Yep. So I'm glad you're working on keeping us safe. And what are some of the things that you've put in place recently?
So our most recent acquisition was multi-factor authentication, which provides real strong identity. It's a modern form of authentication that doesn't rely on a single point of failure, something like a known password, which might be guessed or could be, accidentally divulged to a third party. So this multi-factor authentication is a second form of checking one's identity.
Yeah. You find that most places have that now. I've noticed that they'll send you a text or something. So it's not like we're trying to be burdensome. It's just to keep us safe.
Yeah, it really is. It's a modern form of authentication.
Yeah.
It's really where the industry is going. So
Yeah.
we just want to be, up to speed with what we're doing with our identities.
So hopefully everyone at Silver Cross knows about phishing. But why don't you just tell them what that means, just in case?
Sure. Phishing is interesting. Phishing is when somebody tries to, surreptitiously garner information out of an organization via some means. That can be an email. It could even be a voicemail. It could be a phone call. It could be via text. All it is some method to try and provoke a response from an individual to divulge some information that can be leveraged. It could just be the number of a support contact, it could be the name of a vendor, it could be asking for some aspect of the organization that can then be further leveraged to get further access. We typically see that with email, and that's the most prolific use because it tends to be unconstrained.
Yeah, yeah. So we always have to be on high alert. Did the number of attacks go up during the pandemic?
Absolutely. There was a real interesting day where we had an anomalous spike that was more than 2 standard deviations over what we typically see for inbound mail in a single day. That was exceptional. We're still looking at a lot of where those emails originated from. So it's definitely important to remain vigilant, especially when something like a new term, COVID, completely upturned a lot of machine learning and artificial intelligence models that didn't quite understand how provocative a term COVID was. It was something you could just put in an email, and it was almost certain to get a human response.
Yeah.
Somebody was going to look into that, even though it was seemingly innocuous
Right.
to a
'Cause,
machine.
well, we were all searching for information, and it was hard to come by at the beginning at least. So Teresa, our number one priority at Silver Cross is safety. And what are some of the things that IT has done to promote or contribute to safety here?
Well, there's so many venues where IT contributes to safety. Certainly one is our electronic record. Our ability to alert high risk has really become a critical part of workflow in management of patients, so that we contribute to safety that way. When we think about COVID, we rapidly moved almost 100 employees to a remote environment.
Right.
And so we needed to, for their safety, and so we need to ensure they had the right technology so that they could continue to serve the organization and perform their job adequately. And then another recent example would be the thermal temperature scanning. So, as an additional layer of safety, we wanted employees and medical staff to feel safe coming to work. So implementing that technology was key, which we're now actually using forward-facing. When we think about visitors and guests, we want people to feel safe coming to Silver Cross. So wherever we can leverage that technology to set that environment, we would like to do that.
You mentioned about employees working at home, and I know many IT employees are. How's that been going?
Well, we have 28 employees throughout the division working from home, and it's actually going very well. Pre-COVID, we had a handful that were telecommuting about 2 days a week throughout the division, but then with COVID, we rapidly had several areas that went to a completely remote environment, including service desk. We implemented performance metrics to monitor productivity, and I am very pleased. I'm very happy to say not only have we seen an increase in flexibility with employees, and of course they love it, but a 17% increase in productivity hours around projects,
Right.
and 11% on service requests.
Wow. And I know that's been a request of IT employees for a long time, and many
Yes.
others in the organization
Yes.
too. That's great news. Nathan, anything else you want to add about security overall? Things you want people to know?
Just definitely remain vigilant. If you hear something or see something, definitely say something. Always report into our service desk any security incidents or issues or anything that relates to patient safety, their information. Always report those things in. Patient safety is it's a Hippocratic concern since 400 BC. It's sensitivity to the patient's information as well as their well-being. So it's very important.
Thank you. How about you, Teresa? Closing thoughts?
I would just like to give a shout out to the IT division. We talked about customer service and being agile, and especially in thinking about that during COVID, this was the prime example of technology, managing technology through crisis. So I just want to give a shout out. I am so proud of this division, and they really, really have demonstrated how we can support the organization.
Yeah.
So thank you.
Thank you. Thank you both. Thanks for being here today.
Thank you.
Thank you.